Have you ever awakened from a dream that seemed to be such a life-changing experience and you couldn't recall anything that happened? I know we all have. Sadly, this is the reality for many people today, especially those in the NFL, due to such a traumatic experience such as a concussion. According to Mayo Clinic, a concussion is defined as a traumatic brain injury that alters the way your brain functions. Your brain has the consistency of gelatin, which is cushioned between everyday joints and bulbs. A violent blow to your head or above your shoulders can cause your brain to beat back and forth between the inner walls of your skull. Now that you know what a concussion is, you may be asking, who does it affect? Well, according to CNN in 2012, 261 athletes were diagnosed with a concussion during the preseason and regular season practices and games combined. Also, in 2013, 228 athletes were diagnosed with a concussion during the preseason, regular season practices and games combined. Some famous people that a concussion has altered their life. One which you may know, Mike Webster, who was also known as the turning point for equipment safety, according to Frontline. He was the center for the Pittsburgh Steelers, who died from about 17 concussions that also altered his skin, causing his skin to shelf on his forehead during an autopsy. Also, Troy Aikman, the quarterback for the Dallas Cowboys. After being taken out of the game, he was sent straight to the hospital and was diagnosed with a concussion, but some questioned if he had dementia. However, that was not the case. While reporters were there with him, after having to go undergo surgery, they began to ask him questions. But he replied, "Why am I here? What are you talking about? And what happened?" Now that you know the definition and who it has affected, you're probably wondering, what are some of the symptoms? Some symptoms of a concussion would be a physical imbalance, maybe very severe headaches, confusion, memory loss, or even the loss of consciousness. Finally, I would like to talk about the road to recovery. Some preventions and precautions that one may take would be to wear a helmet. Seems simple, but to be a defensive player, to be properly positioned when realizing you're about to come in contact with an opponent. And finally, to seek annual medical attention to make sure that none of these things or traumatic events have happened to you. Now that I've told you about the definition, who it has affected, symptoms, and necessary precautions, I would like to ask you, what will you do to help prevent such violence